Hello, everyone. Good afternoon. Welcome to the Milwaukee Enrollment Network, or MCEN's annual Milwaukee QHP panel. Really excited to have folks jump on today. I know everyone's signing on here at the top of the hour, and we're familiar with webinar mode here, but we have a lot of slides to get through and some great speakers to talk through some important updates for qualified health plans for this upcoming enrollment season. So we're really excited to jump in and get started. I'll introduce myself. My name is Justin Rivas. I'm the Director of Community Health Initiatives with the Milwaukee Healthcare Partnership, and I'm also the Program Manager of the Milwaukee Enrollment Network, or MCEN. If you do not get MCEN listserv emails for some reason, but you made your way to this webinar, which would be interesting, please reach out to me. I'll have my email a few slides later, and we can get you on the listserv. So really excited to have everyone here for this presentation this afternoon. I'll just name it at the top here. We're going to provide all these slides as well as a whole bunch of resources for everyone after the webinar today, and we'll also have a recording available. So no need to ask about that or to look for that. That'll all be coming your way. The Milwaukee Enrollment Network, or MCEN, I just want to give this little org chart here to help situate what we're talking about this afternoon. We're really a product of the Milwaukee Healthcare Partnership and our strong partner Covering Wisconsin, which is the statewide navigator entity in Wisconsin. And how we function is we have a steering committee made up of multi-sector stakeholder members that really represent all of those stakeholder groups you'll see on this slide below. And today we're really focused on obviously marketplace open enrollment coming up and issuers in the greater Milwaukee area. So that'll be really the focus of our discussion. And I'm really excited to have just representatives from these main qualified health plans in the area. We're going to hear from Deb, Kimberly, Amber, Christine, Doug, and Angela this afternoon. And we have a lot of great content to get to in terms of updates and what to be aware of for any plan changes or new offerings this year. So a lot of info is coming your way. It's going to be a bit of a fire hose, but hopefully you can sit and get a lot of great information on some changes for 2023. So that said, I just want to reframe for folks how we're coming at this from MCEN in terms of the outreach we do and how we support open enrollment. We really focus on our adaptive communications plan and target audience demographics that we work with to really help folks get enrolled in qualified health plans and open enrollment, and also for Medicaid coverage. These are just some of the demographics we really focus on. So as you think through a lot of the conversation this afternoon, I really would like these questions to hopefully resonate with you or just kind of sit with you. And we'll also maybe have time for our panelists to offer some answers to these questions. And we asked very similar questions actually last year, because I think a lot of them still pertain. But just some things to think about. Really, what are some of the most compelling cases for lower income populations to select QHP plans? So that's really some of the target demographic in Milwaukee County. What should consumers consider when choosing the best fit plan? Why do some people not choose certain plans or let plans lapse? And how can we get them back enrolled this season? And just constantly thinking about technology and the adaptive role it plays in our QHP offerings on an annual basis. So I'm just really going to start getting into it, and just want to name that we have all these resources that we're going to talk about available to you today, both the MCEN resources. So I'll be sharing out the comparison chart, the agent referral list, our enrollment year report is kind of the broad picture of what we've accomplished in the last year, and an evaluation link for today's presentation will be coming your way via email. Again, all of the panelists' information, their website links, their plan benefits, grids, their brochures, are all going to live in a Google folder shared drive that will be at this link, and it will be shared with all attendees for the webinar today, in addition to the slides as I named. So with that, and knowing that we have a lot to cover, I'm going to welcome Deb to start talking through Common Ground's offerings for 2023.
Great, thank you, Justin. We really appreciate the opportunity to be here today to present the 2023 product offering that Common Ground Healthcare Cooperative has on the marketplace, both actually on and off exchange this year. So to go through the agenda for Common Ground, we're just going to run through who we are, take a look at our service area networks, We'll talk a little bit about our plan designs and rates, and then some administrative things such as premium payments. So our mission, as it always has been with Common Ground Healthcare Cooperative, is putting members first and pursuing better healthcare. This is a mission that we were founded on, and we continue to live up to that mission. The cooperative was actually founded 10 years ago, actually a little bit more, but it originated out of the Affordable Care Act. We have been celebrating our 10th year this year, and we're really excited to be celebrating that. Our cooperative is not owned by any corporations or health systems. In fact, we are governed by our members. So in order to be a voting member on our board of directors, you actually have to be a member of Common Ground Healthcare Cooperative. And that board of directors provides the strategic direction of our cooperative. We are also nonprofit. We operate in the mutual benefits of our members. Everything that we are taking a look at is, what can we do that is in the best interest of our members? And then any earnings that we make are returned to our members, either through the form of lower premiums or improved services. So the next slide, our service area for 2023, we don't have any changes. 2022, we were in 25 Eastern Wisconsin counties, the same for 2023. We're as far north as Florence County and as far south as Walworth and Kenosha counties. And our provider network, again, the same information. There are no changes for 2023. We continue to be partnered with Aurora, Bell and Theta, and Children's in the Milwaukee area, as well as Dickinson, Door County, and Watertown. This represents over 2,500 primary care providers, 6,500 plus specialists. There are also over 30 hospitals and over 500 clinics available to our members. So that is our network. And then our pharmacy, again, the news for Common Ground in 2023 is that we don't have any changes here. We continue to work with Optum as our pharmacy branch manager. Optum holds all of our pharmacy contracts. You can see that we are contracted with the top national pharmacies, as well as the pharmacies within each of our provider entities, and then many independent pharmacies as well throughout our service area. So again, our members really won't see much for changes as far as our networks, either in the medical or the pharmacy side. When we do have a member that needs to receive care and they may be out of the area, you can go to the next slide, Justin. We do have virtual available for our members. This is an online, either you can go through the website or through an app. It's available anytime, anywhere. If members think they might have a sinus infection or a UTI, pink eye, those types of things, they can go into their app, type in what their symptoms are, and within 30 minutes, they'll receive a treatment plan from a provider, as well as any prescriptions that they would need will have been ordered. This is available anytime, anywhere. There is no cost for virtual for our members that are on silver, gold, and then off exchange platinum plans. Our bronze plans, the first 10 visits are free. Of note, if someone is on an HSA eligible plan, because of the requirements when it comes to services that need to apply to deductible and coinsurance, there will be charges for virtual. Of note, our provider partners also all have telehealth with access through secure video. So if someone is unable to leave their home for any reason, if virtual doesn't quite hit it, they can do virtual visits through their primary provider. What we heard throughout 2022 from navigators and certified CACs, as well as our broker partners and members, are that our naming conventions were very complicated. So as we started to take a look at 2023, we determined that we would simplify our plan names. We took things out like Value 1, Value 2, Value Premier. That really didn't provide much of a description as far as what the product was that the member or consumer was looking at purchasing. So for 2023, our plans are simple. It will have CGHC, which is our abbreviated health plan name. If it is an HSA eligible plan, it will say HSA eligible. Then we just have the metal tier, the deductible, and any other plan identifier. For example, if it's deductible and a $35 office visit copay, that will be noted on there. Our network is Envision Network, and then any add-ons with our dental, allergy, and adult vision options. So you can see the Silver 5000. If you're just purchasing or showing a base plan, it's just going to show the 5,000, and then you can see the next iterations following that. So getting into our plans, as all carriers that are here today on exchange, we are all required to have standard plans where the essential health benefit, deductibles, copays, coinsurance all match. This will make it easier for consumers to compare from carrier to carrier as far as, what is in it, what's the network, what's the premium, where are these plans available. But there will be one gold, one silver, and one bronze plan on exchange for Common Ground Healthcare Cooperatives. Since we do not have a platinum plan on exchange, we will not have a platinum standard plan. But again, our standard plan names, you will see standard in the name. So they will be very easily identifiable. In looking at our portfolio annually, we take a look at, are there plans that are resonating with people, and are there plans that we just aren't selling, or that we can blend into other plans. And so we did make a decision for 2023 to sunset some of our plans. Our medical only versions of the Value Plus Gold and the Value One Bronze will be sunsetting. Of note, those two plans actually have been retooled into our standard plans. When we got the designs for standard plans, we took a look at our portfolio and said, hey, do we have anything that matches or is aligned very closely to what the requirements of the standard plans are? And in gold and bronze, we identified that, yes, we did have two plans. So those have been retooled to meet the requirements of the standard plans. We are also sunsetting our off exchange Platinum Solutions $0 deductible, and then on and off exchange versions of our Gold 3600 and the Premier Silver 3000. It says all plan options. So what that means is any no cost share, limited cost share reduction plans, any of those that are variants of those three plans will no longer be available in 2023. The other thing is in 2022, we piloted a preventive dental option. And what we identified is that we had 3 plan designs where we actually had uptake on those preventive dental options. So what we decided to help slim down the portfolio is that preventive dental would no longer be available on any of our plans, with the exception of our former Silver Value 1, Silver Value 2, and the Bronze Solution $0 deductible. Of course, those plan names will be changing for 2023, and in the upcoming slides, I'll let you know what those new plan names are. Of course, with sunset plans, there is the need for crosswalk. Anyone on that Gold 2000 or Bronze 8700, those members will be crosswalked into our standard plans. All of the other plans will be crosswalked into the next available medical plan. And then the people that were on a dental plan that will no longer be available, they will be crosswalked into another medical plan that has a dental option on it. And we are handling those renewals and those crosswalks. We're somewhat hand-holding them and making sure that those members understand the impact of those changes. So on On our plans, we do have our base plans that are available across the board. We also have on exchange the ability for members to buy up, and what their buy up option is to add on allergy testing and adult vision exam. We received a number of questions last year about what is the allergy testing, and the first and foremost, it goes to medical necessity, where there's need that a person may have some type of reaction to something. Maybe they have celiac disease or seasonal allergies, etc. So the testing includes any type of test that they use, punctures, pricks, nasal swab, those types of things, to determine what their allergies are. And when they have that testing done, the benefits will apply towards their deductible and coinsurance. And then we have our adult vision, which covers one annual adult routine vision exam each year. Of course, pediatric vision, child vision is an essential health benefit, so that is on all of our plans. But for the adults, if they are interested in having coverage at no cost, they can add on that adult vision. And then on 3 of our plans, the Silver 5,000, our Silver 5650, and our Bronze $0 deductible. Those plans do have the buy-up option for a preventive dental coverage. And again, these benefits are at no cost share, no charges to the member. It is solely preventative. It's 2 exams and 2 cleanings annually, 1 set of full mouth and bite wing x-rays, and then fluoride and sealants up to age 14. These plans are also only available in rating areas 1, 9, and 12. Those are 6 counties. Milwaukee County is one of those, Waukesha, Ozaukee, Washington, and then Kenosha and Racine counties. So those are our buy-up options. So when you get to our final plan portfolio, our base plans on exchange, we have a standard plan for gold, silver, and bronze. And then we have 4 base plans in gold, 5 in silver, 6 in bronze, and 1 catastrophic. And you can see the CSR, the cost share reduction plans, are only available on silver, and the no cost share and limited cost share plans are available on all metal tiers with the exception of the catastrophic plan. Our off exchange plans all have allergy testing and adult vision exams standard in those plans. There are none of the other variants off exchange, no CSR, no NCS or LCS. So for our portfolio for 2023 off exchange, you can see that we will have 17 different base plan options. So a lot of information in a short period of time. So what this slide does is it gives you an overview for on exchange. Where are our plans available, which rating areas, and what is on them? So you can see our base plans are available in all of our rating areas. A buy-up option of allergy testing and adult vision on exam are available in all of our rating areas. And then the base plan plus the allergy testing, the adult vision, and the dental exams with limited availability on the 2 silver and 1 bronze plan are only available in the 6 counties of rating areas 1, 9, and 12. So our off exchange plans, similar chart. Again, the allergy testing and adult vision are standard, and then the buy up for dental is again available in those 6 counties. So moving forward into our premium rate changes, we've got it outlined by county, but our overall rate change is 10.4%. This was a bit of a change for Common Ground the last 3 years. We have primarily had rate reductions with COVID and pent-up demand for elective services through the COVID. And the way claims fell last year, we were in a position where we did need to do a premium increase for 2023. So once a member enrolls with us and they're on exchange, and CMS has sent us the file that gets uploaded into our system, The member will receive an invoice, and then they will have 3 different payment options to effectuate their coverage. Plans don't become actually in force until we have received the first month's premium payment. So the first option is that they can go online. We do have a member portal where they can click on Pay My Premium. They can sign into the portal. They are able to make their first month's premium payment once the policy is active. So typically within a day or 2, they can go back in and they can set up recurring payments through that portal. We still receive mail-in checks, and they can be sent to our lockbox at the Milwaukee address. We on occasion do have people stop into our office in Brookfield. So we are located, we are close to Milwaukee, and they can come into our office and make the premium payments. Once the initial premium payment is made, members can actually call in and make their premium payment by phone. We are actually currently in testing for members to be able to make their initial binder payment over the phone, and we anticipate that within the next 2 weeks that will actually be live. Any questions, or if you need additional information, our website is at cgcares.org, or you can go into type in the whole thing, commongroundhealthcare.org, but it's much simpler with CG Cares. You can reach us through our sales line at the number there, or you can email us at sales@commongroundhealthcare. If you have a member that has a claim issue and they're calling in and talking with you, they can always reach out to our member services line that is also shown there. So with that, I'll wrap it up. Thank you very much. We look forward to having a successful 2023 with your assistance, and we are wishing you a very successful open enrollment as well.
Well, great, Deb. Thank you so much, and thanks for just all the great updates on Common Ground's offering for 2023. As I said, this is really a speed dating afternoon, so we're going to keep whipping through. If you have questions for Deb, just drop them in the chat or the Q&A specifically, and we can try and answer those throughout the call today, or the webinar today. And I'm going to take us next, moving forward to network health. And we'll switch off of Deb, and we'll bring him on, and I'll hand it off, Kim.
All right, thanks, Justin. I am excited to be here with you all today to talk about network health. Network Health has been in Wisconsin, serving Wisconsin communities for 40 years. So Justin, if you want to click to the next slide. We're a Wisconsin-based company, and we continue to be co-owned by Freighter Health and Ascension, Wisconsin. So we provide amazing customer service because we're helping our neighbors, our friends, and our families. So when it comes to the network health service area, specifically in Southeast Wisconsin, continuing in the 6 counties, Kenosha, Milwaukee, Ozaukee, Racine, Washington, and Waukesha counties. In Southeast Wisconsin for 2023, we anticipate on average a 4% increase in renewals. In Northeast Wisconsin, we continue to offer plans in Outagamie, Winnebago, and Calumet counties, and we're seeing a slightly higher increase for 2023, and that's going to be right around 10%. When it comes to our provider network, Network Health does have one provider network across both the Northeast and the Southeast plans. That provider network includes Freighter in the Medical College of Wisconsin, Children's Hospital of Wisconsin, Ascension, and then we have others such as Prevea, Bellin, Ignesia, Columbia, St. Mary's, and then the Wheaton Franciscan Healthcare System. So when it comes to our plan offerings for the 2023 year, we wanted to make sure that we were offering a manageable quantity of plans and continue to have names that tell you about what the plans are. So when the naming conventions include the HDHP, high deductible health plan, that also indicates that they are HSA qualified. and we continue to offer plans that include dental, vision, fitness, and some also include 3 free primary care provider visits. So as mentioned earlier, with the new CMS standard plans, we did repurpose 3 of our existing plans, and you can see it noted the standard plan options. And then we will be having 1 brand new plan, which is the Prestige Bronze Plus. So the next slide here just talks about the overall mapping as far as renewal. So there are 3 plans that will not be mapped to the exact same plan from 2022 to 2023. Those would be the Prestige Bronze Zero, the Prestige Silver 20 high deductible health plan, and the Prestige Gold Zero high deductible health plan. So that chart just shows you the overall mapping from a renewal perspective. And our members that do receive a renewal will indicate which plan they're being mapped to. I want to spend a little bit of time talking about the Prestige Bronze copay plan, which also includes dental, vision, and fitness. This continues to be one of our most popular plans. There's no deductible on medical or prescription drug coverage. So it's available in both Northeast and Southeast Wisconsin. There is a low personal care practitioner PCP copayment, and the price is right in the middle of the bronze premium range. So on the next slide, this does give you an overall sample of the benefits that go along with this plan. So very well received plan. We have a lot of people really enjoying this plan. Again, a $55 copayment to see your primary care doctor. There's virtual benefits, which give a $0 copayment. And I think one of the most important things to mention about this plan is that there is a combined medical and pharmacy maximum out of pocket. So we really integrate the pharmacy benefit into the plan overall. So a few additional extra benefits, and this is where we receive a lot of phone calls and just an overall larger amount of inquiries on how these extra benefits work and where you can really see the additional information on these extra benefits. So Network Health continues to work with iMed in order to offer a $0 copayment for that routine adult vision exam. And there's also a $100 allowance that's included for glasses and contacts. There are hundreds of providers that you can use with iMed. Some of the most popular include LensCrafter, Pearl Vision, Target Optical, Shopco Optical, and many other providers. With the plans that have the embedded dental benefit, we do have one change. We're moving from the dental provider of Argus to DentaQuest. And DentaQuest is really going to allow us to beef up the provider network. So with this change, we'll continue to have a $0 copayment for one routine dental exam, a cleaning, and a bite wing x-ray per year. Some of the additional extra benefits that our plans have is a wellness program, which we call Momentum. Members and their spouses can complete 4 tasks to receive a $100 gift card or $100 gift card annually. Those tasks include taking the online health risk assessment, receiving their flu vaccine, having an annual wellness visit, and then designating a personal doctor. Another extra benefit with our program is the embedded fitness benefit, and we utilize the WellBeats digital fitness platform. And so they have lots of online fitness classes, nutritional demos, all at no cost to our members. So what's really fun about this program is they have different programs, and then it'll recommend classes based on what you took last, so that people can have a nice variety. When you visit our website, which is networkhealth.com, you can click on the for members and employers. And once you hover over the individual and family members section, you'll see the extra benefits tab. And from the extra benefits tab is really where you're going to be able to find all the network of providers and who can you go to about those additional supplemental benefits. So it's a great resource for members or people looking and considering the network health plans. Network Health continues to work with MD Live to offer virtual visits. This is a great tool if people don't have time to maybe go see their primary care doctor, if they're having minor health issues like a fever, sore throat, if they think they have a sinus infection. So with this plan, MD Live has the visits. People that have the health savings account, they would have a $55 co-payments. All the non-HSA plans, this would be a $0 cost to our members. So it's a great, quick resource. With Network Health, we do have a great emergency travel benefit. So if a member seeks urgent or emergent care at an out-of-network hospital-based urgent care facility or an emergency room, the member will be treated as if they are in network for the initial injury or illness. We do ask that follow-up care is provided by an in-network provider, or if that's not possible, the member could submit for a prior authorization if they're still, let's say, traveling and need to have additional follow-up care. Network Health will pay the claims at the billed charge amount, and the member will not be balance billed. So I know how the benefits work when people are traveling is always a very important question. Switching gears to talk about the pharmacy benefit, Network Health continues to work with Express Scripts, which has an extensive pharmacy network, continue to have Walgreens, Meijer, Walmart, and Costco, for examples, all within that network of providers. There are also many independent pharmacies that participates. Also want to mention deductibles and out-of-pocket maximums with all the network health plans are integrated for both pharmacy and medical expenses. There is also mail order if that's something that's of interest. One of the changes Network Health is making, and I'm really excited about this change, is we are moving from a 6-tier pharmacy benefit to a 5-tier. Nothing is being eliminated. We're just shifting the tiering around. Frankly, that'll help our information pop up to be more apples to apples to our competitors and be easier for all of you to see how the tiers line up. So excited about that change. Network Health does also offer an insulin patient assurance program. So this is something that we've offered now for a few years in a row, where we put our preferred brand or our tier 2 medications so that members can have access to their insulin for no more than $25 for a 30-day supply, $50 for a 60-day supply, and $75 for a 90-day supply. So we do have some preferred products like the Humalog, to name one. So this is something that they can use either via an in-network retail pharmacy, or they can get this through Express Scripts through the mail order. So just some additional information on what the process is when a new member effectuates. They're going to submit the application. They can wait for the invoice or the application to be received at Network Health, and then a paper invoice will be sent to members. So in order to pay that initial binder payment, there are several different ways in which they can do that. So that's covered on the next slide. The first is right away from the FFM, they can make their payment, so it'll connect to our portal. They can mail in a check to our lockbox in Milwaukee. They can drop off payments in either the Menasha or the Brookfield office. And then they can also pay by credit card or set up an ACH payment by giving Network Health a call. And then finally, once that initial premium is received, we'll go ahead and get those ID cards out in the mail. From a materials perspective, I know that you'll receive information. If you would like any hard copies, you can certainly reach out to us directly at Network Health. On the next slide, there's a phone number for materials, or if you would like the printed copies of materials, you can always send an email to the individual sales team at networkhealth.com. So thank you very much for your time and attention. And if you need additional support, please feel free to give us a call.
Kim, thank you so much. Excellent overview. And I think you covered a lot of details, and it's good to see some kind of alignment across plans this year. So really helpful. I thought it was helpful also to see just some of the extra benefits that were available for members. So a great local opportunity here. Please reach out to Kim and the sales team here with more questions. Also drop them into the chat. Everyone will be on for the remainder of the webinar. So thanks much on Network Health, and we're gonna keep on cruising, as I say. And next up we have Amber, who's gonna share with us about Molina.
Hello, everyone. My name is Amber and I'm from Molina. And today I'm going to be going over some key benefits and plans for the upcoming Marketplace 2023 open enrollment. I just want to quickly say, as Justin mentioned, you will receive a copy of these slides. I'll be going through some of them pretty quickly, but just want to make sure that you know that you'll get a copy and you still have access to the information. And I also want to start by thanking you all for the important work you do every day in making sure Wisconsin residents get the coverage they need. Molina values the critical work you do every day in helping consumers make the best choice for them and their family. And really my goal today is to talk about what Molina offers, and hopefully it will be a fit for some of your consumer healthcare needs. And really overall, our goal is to give control and options to the members and just make sure that they have the tools and information they need to make a decision. So to just quickly look at our agenda, be going through, some of the same standard stuff, a quick note about Molina, our service area, plan overview, network, and then some of our supporting services. And I just want to start with sharing a little bit about Molina as a company. Molina's mission is to provide quality healthcare to people receiving government assistance, and our plans and products are designed to offer low-cost options to some of the most vulnerable populations in Wisconsin. Our focus really is within 3 lines of business: Marketplace, Medicare, and Medicaid. This slide, the next slide, shows a map of our service area by county and by line of business. It does show recent expansions for Medicaid into Dane County and a few other new counties for Medicare in 2022. We are not expanding our service area for Marketplace in 2023. The next slide talks through the Wisconsin portfolio provisions for 2023. This shows the migration of some of our plans on the silver and gold, so you can see how they are mapping over to our 2023 plans. So on the left-hand side, you'll see the 2022 plans, and then on the right hand is where they're migrating over to for 2023. The Silver 1 and Silver 1 Plus Vision plans will stay the same, and you'll see that the Silver 2, 4, and 7 plans are discontinued, but will migrate into the Silver 1 plan. And we are adding a new CMS Silver 8 plan for this year. On the bottom, you'll see the gold migration, gold 1 and gold 1 plus vision will remain the same. And then we'll be adding the new CMS gold 8 plan for this year. The next slide is just a snap of our benefits at a glance, and I'll talk through it at a really high level overview. As mentioned, you'll get a version of this, so you'll be able to see it a little bit better. One of the plan benefits that I'd like to point out is the Constant Care Silver 100 plan that has a $0 deductible. This is a very rich plan and also includes a $600 per day copay for inpatient facility. We got a lot of questions about that last year. So, just a quick example, let's say a member was admitted to the hospital for 10 days. The maximum facility charge they would pay for that stay is $1,200. So just that 2-day $600 copay. The silver plans are also useful for people who see specialists regularly, as there's a copay for this plan of $10. I do want to call out that some of the other plans, there is a prescription deductible that only applies to tier 3 and tier 4 medications. And on this slide and the next slide, I'll talk through a few more of our plans. I just want to call out that the services with the blue background are copay based. All of Molina's plans have copay based plan designs for outpatient professional office visits, which include PCP, specialists, mental and behavioral health, and the rehabilitative services. Thinking back to some of the questions that Justin had when he first pulled up the slides, what might be a good fit for these types of plans. If you have members who know that they need to see their PCP, or if they are going to have specialist visits throughout the year, having these copay based designs are really beneficial because it allows the member to know upfront what the cost will be. We know that the uncertainty of sometimes having to pay towards a deductible for an office visit can detract members from seeing care, and it causes some, uncertainty and uneasiness. So knowing that cost up front really helps the member make that informed decision and can ease some of those potential barriers to cost with that copay based design. The next line is just the continuation of the plans, and this one you'll see on the right hand side does have some of our gold plan information. I also wanted to mention our new Constant Care Silver 8, which is this CMS plan that we'll be rolling out. And I also want to point out again that there is a prescription deductible for some of the plans on this slide, but it only applies to the tier 3 and tier 4. So the tier 1 and 2 will continue to be copay based for those medications. And as I mentioned, you'll receive an electronic version of the benefits at a glance. But if you would like printed copies, because I know sometimes it's nice to have them printed, you can reach out to me, or there's contact information on the last slide that you can reach out to for printed copies of this or any other Molina material. One strength of Molina is our provider network. With Molina, our members have access to an expansive network of primary care specialists and hospitals. This slide shows the major hospital systems that are in network. And 2 points I want to point out. The first one, I know it's not as big of an impact for southeastern Wisconsin, but if you do help consumers in other parts of the state, I just want to call out that Marshfield Clinic is in network. And that's going to be a really great add for our members in north central Wisconsin. And then for southeastern Wisconsin, just wanting to point out that Molina is the only QHP that we have Aurora, Ascension, and Children's in network. And I just want to call out as a reminder, when checking if a provider is in network, make sure that you check, the member checks both the doctor and the location are in network. And you can search for providers using our new Molina online provider directory. After this session and some of the materials that Justin will send out, you'll get a map of Wisconsin that shows the major hospital systems we have in each county. So as I mentioned, you can look up providers using our provider online directory. Included on this slide is the link that you can use as a quick access. Otherwise, you can always go to the Molina Public website and click on find a provider or pharmacy. The next slide just calls out a few of the new filters that we've added to help members with their search. So they can filter using zip code, doctor's name, locations. There's also a login button that makes it easy for members to go directly from the online directory into their My Molina account. And then they can do some more personalized search functionality and have a pretty user-friendly experience when they log in. And I'll talk a little bit more about our app, the My Molina app, in a few slides. I do want to just point out that Molina continues to offer free telehealth services through Teladoc. This provides easy access to convenient and affordable healthcare. Members can speak with a doctor on their phone, through internet, through a video, or through their app. And Teladoc offers an affordable option for when members are outside the Molina service area. The only out-of-network benefit that Molina offers is emergency services. So if a member is out of town or out of our service area, and let's say they have a sore throat or something that doesn't necessarily require emergent care, they can always use Teladoc. It's completely free, and then they don't risk going out of network, or they don't have to have an unnecessary visit to emergency. So Molina encourages members to register right away so that they are registered with Teladoc whenever they need care, and they can register through the app, online, or by calling. Molina knows that access to medication is another important factor when selecting a marketplace plan. Molina does contract our pharmacy services through CVS and Caremark, but this does not mean that Molinas are restricted to only CVS pharmacies. You can find any of our in-network pharmacies by using the link on the PowerPoint, or going to molinahealthcare.com and clicking on Find a Doctor or Pharmacy. Molina does offer a wide selection of pharmacies, including many of the provider pharmacies. I know we've gotten that question in the past, so I just want to make sure you know that many of our provider pharmacies are in network. And we want to just make sure, and that's, sorry, just one quick note about pharmacies. We just always want to make sure a member knows what it means if a drug is not covered. You can look up covered drugs by going to our drug formulary on molinamarketplace.com. And if a drug isn't covered, it means that they will be required to use a generic or preferred name brand. I know that sometimes members get confused about what's covered and what's not. So I just want to call that out, that they'll be first asked to use that generic or preferred name brand. Molina is also excited to share that we offer a wellness program, My Health Perks. My Health Perks offers programs and information to support healthy lifestyle. And in addition, members can earn a physical or digital $50 gift card if they complete the health risk assessment and complete an annual wellness exam. This program is completely voluntary and open to all subscribers and dependents 18 years and older, and it can be accessed through the My Molina member portal. And just want to call out that this is completely free preventive care for the member, and then they do get that $50 gift card as a result. I just want to call out some of the benefits that you can use through the My Molina portal and mobile app. Members can get their ID card electronically through here. They can also request to have a physical ID card mailed to them. Members can track their spending, check a claim status, track copays and deductibles, and a lot more through this app. They can also use this, as I mentioned, to sign up for the wellness program or change or select their PCP. There are a number of different payment methods offered to members. Next slide. Members can log into their My Molina account and schedule an auto pay. They can make one-time payments online or by phone. So if you do make that one-time online payment, you can do that right away when you send in your application for Molina. You don't have to wait for us to mail you, a physical pay slip. I know sometimes that makes it easier if you can just pay right away. Members can also pay by phone. I just want to point out that pay by mail. If you do pay by mail, to leave about 14 extra days to allow processing through USPS. Sometimes that does cause a delay for it to get through the mail. And then members can also use any MoneyGram location with cash. And I'm just being cognizant of time. There are a number of other member support options for members. They can select which services is best for them, whether it's a self-service through the My Molina portal or app, or they can always call our Molina member services and talk with a person. We also have the 24-hour nurse advice line, which is another great resource for our members. The next slide just has a few things that I can call out for Molina highlights. The one thing I do want to just point out on here is some of the PCP flexibilities. So members do have the option to assign a PCP at the time of enrollment, but they can also change a PCP at any time. If they don't select at the time of enrollment, they will get auto assigned, but members are not restricted to only see who their assigned PCP is in the system. And then also family members can be assigned to different PCPs. So we do want to make sure that we have a lot of flexibilities with that to make sure that that's not any kind of barrier or access to care issue. If you do have any questions, we do have a dedicated team that you can reach out to through email on this email address. You can also reach out to our Molina Marketplace Sales Manager, Kristen. She has her cell phone number and email address there as well. You can also always call our Molina Member Services. And then if you have any questions about billing and payments, that phone number is provided. As I mentioned, if you want any Molina member printed materials sent to you, you can just reach out to that MHWI Assister Help email and we will get it sent over to you at no charge. And thank you so much for attending today and for all of the work that you do. And we also look forward to having a really successful open enrollment with you this year.
Amber, thank you so much. That was such an excellent overview, and I really appreciate some of the tips you offered in terms of the questions I asked and supporting some of the plan selection for enrollment assisters that are attending today. So I really appreciate that extra bit of content. As you said, being conscious of time, I'm just going to keep on going. So we have Christine up next with Chorus Community Health Plans, which may sound like a new name to some of you, and she'll share more.
Yes, thank you so much. I appreciate the opportunity to share with you guys today. And as Justin mentioned, a lot of good information to share. So I'm just going to jump right in to our agenda. Like he said, we are going to speak a little bit about our new name and introducing that to everybody if you have not heard about it yet. Talk through some value adds, our member programs and tools, wellness incentives and coverage perks. We'll go into our service area and provider network, and then a plan overview of both our health and dental plans. And then I'll quickly touch on enrollment, renewals, and our website. So Chorus Community Health Plans is our new name. You've probably heard us as Together with CCHP previously. We are a non-for-profit mission-driven organization. We're still affiliated with Children's Wisconsin, and we're really proud of that affiliation. So we will be continuing that. We did become a Medicaid HMO in 2006, and since then have just continued to grow and build our product portfolio. In 2014, we did launch our Care for Kids foster care program, care coordination program, and that's been really successful. And then the reason why we're here today is to talk about our individual and family product line, which launched in 2017. In 2022, we did add on a standalone dental plan in 6 of our southeastern counties. And then in 2022, just September, actually, September 1st, we changed our name to Chorus Community Health Plans. So this was a collective change for all of our product lines. So between Together with CCHP and Children's Community Health Plan, our Medicaid product line, we will now be known as Chorus Community Health Plans together. This just really reinforces our commitment to serve all of the community at many ages and stages of their life. And then collectively among all of our product lines, we have about 170,000 members in the state. All of our IFP plans, we are EPO plans. They're available both on and off the exchange. And they do cover all of the essential health benefits required by the ACA. Our health plans are available in the 15 eastern counties in Wisconsin. So we are available in Brown, Calumet, Dorr, Kenosha, Kewaunee, Manitowoc, Milwaukee, Oconto, Outagamie, Ozaukee, Racine. We're moving into Sheboygan County for 2023, and then we are also in Washington, Waukesha, and Winnebago counties. And then, as mentioned, our dental plan is available in the southeastern 6 counties. As far as our member value adds, we really put a focus on understanding our members outside of just even in the doctor's office and the core benefits on our plans. So we do spend a lot of time in our community meeting our members where they're at and understanding both their health and social needs. That includes providing programs for things like transportation, housing, food insecurities, childcare, and the things that need to be addressed to really address their overall health. Our team is, our support team is local, so we are here local to the Milwaukee area, and so we're available to meet with our members on a regular basis, and as well as meet with our broker and sister communities. And then our customer service teams have been recognized for their service, and they consistently provide what we would call really great service, and they're meeting those SLA metrics and serving our members. We do offer a variety of member incentives, programs, and extra benefits that really just empower our members to manage their health. So we'll go into a little bit of detail into those in a little bit later in the presentation. I'm just going to call out a couple of those member programs and tools. Our first one is our CCHP on Call, which is our 24-hour nurse line. That is an unlimited nurse line to our members at no cost. They can speak to a registered nurse. The nurse will triage their symptoms, and then if needed, an MD will be able to provide the advice and then send a prescription to the local pharmacy. We do also offer a treatment cost calculator to our members. This is a partnership with IBM, which is now called Meredith. It's a tool that's available in the members member portal, and it does provide estimates for a lot of different services up front. We do use local provided data and then the members' actual plan data as well to give them the best estimate. It's been really helpful for our members to kind of see and make informed decisions on where to go for services between different providers in the area. Another really good partnership that we have is with FoodSmart. This is available to all of our members. It is a telenutrition program, both with an app and then access to registered dietitians. And they can do meal planning, make grocery lists, get a lot of support for a lot of different things. If they have any kind of dietary restrictions, they can work with the dietitians to really manage that. We also do have our Blue Star app. This is an on-the-go app for members who have type 1 diabetes. It helps them to manage all of the symptoms that come along with that, medications, doctor's visits, and things like that. It is available to any member who qualifies, and then we do also incentivize members for signing up for the app. I did mention we have wellness incentives. Those are going to continue for 2023. We have a lot of different incentives for basic things that members do on a daily basis regardless, going in for their wellness physical yearly, completing a health risk assessment online, signing up for a member portal. And then we have some program specific incentives, like I mentioned, for our diabetes incentive program, our Healthy Mom, Healthy Baby program for those members who are either pregnant or family planning, and then also our FoodSmart app. We do have various coverage perks that I just wanted to highlight. We don't balance bill for members utilizing out-of-network, out-of-service emergency care. So if you do have a member going in for emergency care, either at an emergency room or urgent care, those will be treated as if they are in network. We have extended our PT and ST benefits. Those are typically 20 visits each, and those we're able to extend those to 30 visits each. We will continue our condition-specific case management programs for things like depression, asthma, diabetes. So members do have the opportunity to become a part of those programs to really help manage those conditions that they're going to have. And then we also do have $0 preventive care and medications. And then we include select insulin medications at $0 as well. Our service area is not changing much for next year, but we are moving into Sheboygan County, as I mentioned earlier. So we're excited about that. We also are going to add HSHS and Prevea to our network in the northern counties. So those will be available starting 2023. We do have the easy to access Find a Doc tool on our website. It is pretty intuitive. The only thing that I will call out and mention is that we do have still have that do not publish list for any provider who chooses not to be published on the Find a Doc tool. If you do feel like they should be in the provider network because they're affiliated with one of these hospital systems, just give us a call or send us an email and we can definitely check for you. And then just to give a quick health plan overview for 2023, we will have 13 plans available, both on and off the exchange. We will have a catastrophic plan, plans in the bronze, silver, and gold medal levels. We will continue to have one silver off exchange only plan that is available only on our website. That is our Silver Choice plan. We'll have one HSA eligible plan, which is our Chorus Bronze HDHP plan. We saw a lot of success with our $0 deductible bronze plan in 2022, so we will be expanding to have a $0 silver, $0 deductible silver plan for 2023. And then, as mentioned by other panelists, we will have those 3 standardized plans per CMS, and those will be called out as our core plans in both bronze, silver, and gold tiers. We do offer child-only policies, so you can write just child-only policies both on and off the exchange. And then anybody under the age of 40, we will not rate for any tobacco use. For 2023, we did file our plans with an average of less than 1% increase across all of our plans and geographical regions. So we tried to keep those premiums as low as possible for people. Our prescription benefit coverage will not be changing too much either, which is good. We will continue to partner with Express Scripts to offer prescription medication coverage. We will have 6 tiers on our formulary. So we will have our select generic and insulin medications at no cost, which is tier 6. $0 preventive medications at tier 5. We will continue to offer copays on most of our plan levels on tiers 1 and 2. So those are our generics and our preferred brand names. Do want to call out that we will have step therapy requirements for some brand name prescriptions. So they will be required to use generics prior and go through that process. We'll continue to have a lot of the local pharmacies as well as pharmacies while people are traveling in the network. So Walgreens, CVS, Target, Costco, Walmart, all of the major players. And then just wanted to also point out, we will have mail order prescription options, and they do get those discounted copays if they choose 90-day supplies. We do offer 2 preferred specialty pharmacies. Those are Credo and then the Freighter Specialty Pharmacy. And then as always, people can find our prescription drug list on our website. And if they're having any issues with that, can always reach out. For our dental plan, we will have 3 plans available to all ages and family members. So that includes anybody 65 and older and child-only plans. They're available in the southeastern counties. So that's going to be Milwaukee, Kenosha, Racine, Waukesha, Ozaukee, and Washington. We provide in and out of network benefits. So if the provider is not in our network for some reason, they still can utilize the plan. It will just be at a little bit of additional cost share. Our plans do offer preventive, basic, major, and some pediatric orthodontic benefits. Our Essential Plan, which is our newest plan for 2023, will offer adult preventive only and then child comprehensive benefits. And then just wanted to also call out that there are waiting periods for the plans for our standard and our premier plans for adults only on the basic and major services. So that's important to just recognize on those plans. And then before I head into the enrollment and current member renewals, I'll just let you know that we will have product grids on our website. And then you'll also get a copy of our prospective member brochure that have the product grids in there as well. So we'll go into a lot more detail than I was able to on the slides regarding our plans. If you have any questions, you can let us know. As far as enrollment goes and renewals, everything is going to stay pretty much the same. Sorry, Justin, can you go back one more slide? Our members can enroll via healthcare.gov or directly on our website. And then just another reminder that that off-exchange Silver Choice plan is only available on our website. For any current members, renewal packets are going out as we speak this week. And then that will include information regarding their new plan. All of our members are actually being mapped to the same exact plan that they are on for 2022. We're not getting rid of any plans. The only exception to that will be as if they're 30 years old, aging off a catastrophic plan, then we'll be putting them onto one of our bronze plans. And then all of our renewals are automatic. So it's just important to remember to cancel anybody who's not looking to renew, make sure that any auto pay is turned off so that people are not getting charged for multiple plans, because that's never fun. But all those details will be in the renewal letters and in the packet that they receive when they re-enroll. And then as far as after enrollment goes, our members do receive a confirmation of enrollment letter. This goes out to members rather as soon as they re-enroll or enroll for the first time with us. They'll also receive an invoice. This will be mailed out mid-December to pay that first premium if they hadn't done that at the time of application. And then ID cards will also go out to all current members and then new members upon effectuation. Our welcome kit will also go out to all current members and new members upon effectuation. That includes a lot of helpful information to make the most out of their plan. And then a lot of the information is also available on our website. And then for effectuating the coverage, members do have really flexible payment options. We obviously recommend that if they can, they pay at the time of application. But if that is not something that they can do, then they can make a one-time payment over the phone. They can sign up for their member portal, and we do recommend that as well. They'll get an ID number rather in their confirmation of enrollment letter, and that will help them sign up for the portal. They can pay by mail if they'd like to, and then they can also make payments over the phone or fill out an auto pay form. Our website, like I mentioned, has a ton of information, very helpful. We did actually just redo it in the last year, so we're hoping that it's a lot more user-friendly for people. But when accessing our website, members or new members who are prospective will go out to our plans and be able to click through the different pages to help them through that process or sign up for the member portal. And then as always, we're here for questions. You can email us, you can call us. Members who are actually currently enrolled can also call customer service. And then if you do want to have any kind of printed brochures, like I mentioned, this will come out electronically, but printed brochures are available and you can email us that. We just ask that you send us the quantity needed, name, and then the address where to mail them to. So with that, I am done. Thank you so much. We appreciate the time and I really look forward to open enrollment. Thank you, Justin.
Thank you, Christine. Exciting to hear about the name change and just the new website looks great. So awesome, just kind of overview, of course, community health plans. I do appreciate it. Of course, reach out to Christine in the chat or this contact information with more questions. I ask folks if they're available to stick on for an extra 5 to 10 minutes afterwards. I want to give everyone at least a 15-minute slot to talk. So I'm going to move next on to Anthem and have Doug Arnold share with us.
Hey, Justin, thank you very much. I really appreciate it. It's great to see everybody online today to take in this important information. I really want to just say thank you to Covering Wisconsin and the regional enrollment networks. Sorry about my voice, by the way. Lost it about 2 weeks ago and it hasn't come back. But really the support that everyone's doing from, community engagement to everything that's going on in the state of Wisconsin. It's really been great to be part of these conversations on a go forward basis. So thank you for this opportunity. Justin, next slide, please. So one of the things that, we're very proud of here at Anthem is that we have, regardless of where you are in your continuum of life and continuum of care, we have a lot of different options available to you in our broad product portfolios, be it Medicare, Medicaid, or marketplace plans. And we're really proud of that. And some of the resources that you have here, and again, this is a slide that Justin's going to share with you, will be how to connect with Anthem, regardless of where you are in your course of life or your course of care. And we're really proud to have options available for and to really serve the communities that we live in. Next slide, please. One of the things too is that this year we've put together very specific navigator support resources that are available. So this is a dedicated 800 number or 866 number specifically for navigators, application counselors, certified application counselors, enrollment assisters, and things like that to be able to get the support necessary in navigating Anthem. One of the things that we gave Justin, he's going to provide that after the fact, is really a one-page slick. That's Anthem Navigator resources. So it's the URL addresses, it's how to do a quote, it's the how to find care, all the prescription information that's going to be supported as part of that. And we're really proud of those resources that we put together to support navigators in the marketplace. The other thing is obviously we have resources for members. If they want to do a direct enrollment support, they can call us at the 844 number associated with it, or they can enroll directly on going to enroll.anthem.com and be able to get that information necessary if in fact they are self-navigating. Next slide, please. So what's new for 2023? For us, we're really excited about 2023 because there's two really big things that are happening. One, we're going to continue to offer our pathway network that's available in 9 counties. So that's Milwaukee, Washington, Ozaukee, Waukesha, Racine, Kenosha, Calumet, Outagamie, and Winnebago. But new for 2023 is we're going to be adding pro healthcare to our network. And one of the things that you're going to start seeing this month and through the end of December is a lot of bus ads and things like that at bus stops where you're going to actually see pro healthcare and Anthem's name out there. So that's going to be exciting in Waukesha and Milwaukee counties. And then what's really exciting for 2023 is that we're also going to be offering our Blue Preferred network. So that is our broad network, and it's going to be available in 68 counties. And it's going to be the first time in a long time that we're going to be offering our broadest network access across the state. So members in Pathway Network could also look at maybe having a broader network in the Blue Preferred network. So let's go to the next slide. So we'll go into greater detail with what this looks like. So here's our Pathway service area. Again, it covers rating regions 1, 9, 12, and 3 counties in rating region 11. It includes Ascension, Children's, Concentra, and for 1/1/23 now includes pro healthcare and other urgent care facilities and retail clinics. So it is an HMO product on our Pathway network. So I think it's really important to know the network name, because when you're looking at the provider finder, you want to make sure that you're navigating by the correct network. Primary care physician and gatekeeper is not mandatory as part of this, and the primary care physician name will not be printed on the ID card. There will be limited out-of-network services limited to urgent and emergent care. And as far as the number of plans that we're going to be offering as part of Pathways, there's going to be 7 bronze, 4 silver, and 2 gold plans, both on traditional and HSA plan selections. Next slide, please. And then this is our Blue Preferred service area. So it is the network with the broadest coverage across Wisconsin. To find the care tool, you can go to anthem.com, and then you can look to find the providers that are in their service area. The providers include providers such as Ascension, Aurora Healthcare, Bellin, Children's, Concentra, Freighter, HSHS, Marshfield, Pro Healthcare, SSM Healthcare, Theta Care, UW hospitals, and other hospitals and urgent facilities and retail healthcare clinics. So again, it's very similar to Pathways in that it's an HMO product. There is no gatekeeper or no mandatory primary care physician that's part of the selection. It's going to be limited blue card again for urgent and emergent care only. So there is no out-of-network coverage outside of the state of Wisconsin, other than for urgent and emergent. And again, much like the Pathways, we're going to have 7 bronze plans, 4 silver plans, and 2 gold plans, both on traditional and HSA plans. Next slide, please. So this is just a little bit of what the ID card looks like. So the member support, member services, and the contact information associated with the ID card, just to get members familiar with what they will receive after they enroll with Anthem Blue Cross Blue Shield. Next slide, please. And then much like all the other carriers that you've heard from today, there are a lot of billing options available to members to effectuate their coverage or to pay their premium. So they can set up an automatic monthly bank account draft. They can set up payment through a credit or debit card change. They can even choose to get a payment sent to them or a bill sent to them, or they can go on to anthem.com to choose their payment mode. So there's a lot of different options that are going to be available to members in 2023 in how to effectuate their coverage and then how to continue to pay their premiums with Anthem. Next slide, please. So this is just so, because I know we have Navigator certified application counselors and other assisters on, but there's also, I'm sure there's some brokers that are online. So here's some just useful links on to get certified on the federally facilitated marketplace and what happens if you're returning to the returning broker, and then how to check your status on the federally facilitated marketplace on, are you ready to sell for OEP for 2023? Next slide, please. So obviously, open enrollment starts November 1st, and we're really excited about the opportunities. So open enrollment's November 1st through January 15th. If members want coverage effective January 1st, they need to enroll by December 15th. We are excited about all the various options that we have available for our members going into 2023, in addition to those network options that we talked about. A lot of things that we're having is around the tools, the digital wellness tools that are going to be provided. There are all obviously special member discounts on vitamins and weight loss coaching and fitness club memberships. And we also have the ability for members to purchase dental and vision coverage going into 2023. And we have a robust pharmacy program that is also available for members that sign on. And then we also have all of our available tools through anthem.com so that people can find their doctors and hospitals and pharmacy information that's associated with that. Next slide, Justin. So one of the things too, much like some of the other carriers, we are offering Smart Reward Program. So we're providing incentives, and these are digital gift cards that are going to be delivered by email. So you can get a $20 gift card by completing a health assessment, or you can get a $25 gift card by doing your annual wellness or well woman exam within the first 90 days when your plan begins. And so we're really trying to provide incentives for members to take advantage of the program and to see what resources that we have available and to get engaged in their wellness journey early. Next slide, please. So some of the things that I talked about too is there is obviously standalone Anthem dental and vision programs that can be purchased. There are other things like critical illness, hospital indemnity, and accident plans that can be purchased through this. And then also, if there are people that are traveling internationally, we do have Geo Blue programs that are available that can help them as they're traveling, perhaps out of the country for an extended duration that's associated with that program. Next slide, Justin. So in a snapshot, I know I talked a little bit about the programs, but we do have live health online visits that are available. We do have obviously virtual primary care visits that are available. We also have select tier 1 prescription drug program that is free to a lot of members that are a part of the traditional, all the ACA plans. that's not available for HSA or catastrophic plans. But we really are spending a lot of time on some of the digital programs and wellness solutions through our Sydney Health app. And I'm going to get to that in a little bit. Next slide, please. So here's a little bit about pharmacy. Next slide. So if you don't know, our pharmacy vendor is our homegrown vendor. It's IngenioRx. Starting January 1 of 2023, you're going to start to see a new naming convention related to Ingenio. It's called Carillon RX, but you will probably see the names interchangeably. But IngenioRx really helps to empower individuals to make better choices. Excuse me, it's 24/7 access to dedicated pharmacy experts. There's a lot of tools that are available on how to find a prescription and to fill a prescription. Next slide, please. And sorry if I'm running through these, but I know that we have to allow time for some other folks. But and then we have this is no different than we've done in the past, but we do have an RX Choice tiered network. So we have more than 67,000 pharmacies that are part of our network, and there's 27,000 that are designated at level 1. Next slide, please. So level 1 includes CVS, Target, and Walmart. Again, that's 27,000 pharmacies. Members are going to pay less out of pocket for these prescriptions, and there's a lower contracted rate, meaning lower cost for the members. Next slide, please. So this is our level 2 pharmacy, which includes Walgreens, Costco, Sam's, Rite Aid, and Giant Eagle. Again, this is our non-preferred pharmacy, so the member cost share is going to be slightly higher than they would get in a level 1. Next slide, please. And then our select formularies. So this is a select formulary is what we've been using for the last several years as part of our pharmacy offering. It's a closed pharmacy. It really is focused on driving the lowest cost of care options for our members. And to find more about this, there's this tool that's associated, but Justin also has a one-pager to be able to navigate the formularies that we have here at Anthem. And he's going to be providing that as part of the follow-up as his presentation. Next slide, please. And then, as I mentioned, there are going to be some free select drugs and free select drugs that are associated with our pharmacy programs for individuals for 2023. I have given that 0 select drug list to Justin, and he's going to provide that as a follow-up to everyone post meeting so that you'll have that available. Next slide, please. And then let's go one more slide, Justin. And this is the digital solutions that I've been talking about. So this is Sydney Health, right? So this is really the front door into your member experience with Anthem. And so we strongly encourage everyone to download the Sydney Health app. And this gives them an opportunity to really engage virtual primary care. It's a way to find a provider. It also has connections to wellness. And then some of the digital challenges that we have and some of the embedded videos. But it's also good because it has your health history via your health records. It allows you to fill and find updates related to your pharmacy. And it allows you to really tailor your experience with Anthem. And this really is again, the front door into your healthcare experience with Anthem, regardless if you're an individual member or maybe you're a commercial member with us today. Sydney Health is really going to be a really important tool for all of our members to get the most out of their experience with Anthem. Next slide, please. And another slide, please. So behavioral health is really important for us. And it's something that we're really focused on, especially post-COVID. And we want to make sure that there's a lot of emotional well-being resources available. Some of this stuff can be found directly through the Sydney Health app that I just talked about, including some virtual psychology. 24/7 call center is also available. And then our behavioral health case management is included in any of our care coordination plans that we have associated with Anthem. Next slide, please. And then one more slide, please, Justin. So this is, while this is related to producers, this is where a lot of information can be found for our producers, either through the Broker Plus app or by going on to anthem.com to find out more. But the next slide is more agnostic. So you can find anything about Anthem by going to the Anthem Broker Hub, visiting that information, and it'll have all the information regarding our plan grids, open enrollment information that's associated with it, and anything that you need to know about Anthem in the state of Wisconsin. The other thing about this, if you are doing business in other states and you're doing business with Anthem, you can actually do the drop-down menu and find other resources for other states that maybe that you're doing business in. So it's a great resource to bookmark, and I would highly encourage everyone to use that. Next slide, please. So I just want to say thank you. I know that was kind of the Reader's Digest version associated with Anthem, but I trust that Justin is going to share all the resources that we've given, including the plan grids, the navigator resource guide, and all those things that I think are going to make open enrollment really rewarding for all of you. But I just want to say thank you on behalf of Anthem and representing the market as well as you do. Thank you.
Thank you, Doug. Excellent overview. So much covered, I know. And as Doug mentioned, we will have all of those resources and tools available in that shared folder, especially that one pager that kind of is new this year. I think that was really helpful. I took a look at it, just a quick glance, but great update. And you were really just a minute over, but I want to give some time here to Angela. So if everyone could stay on for an extra 5 or 10 minutes just to get her time slot here for course, that'd be great. Angela, I'll welcome you on, and we're going to jump right to you.
Okay, thank you. And thank you for letting me participate, and thank you for everybody staying a little bit later. Just to give you a little bit of background on Quartz, for some of you that may not know us, we've actually been in the industry. We're going on our 25th year in 2023. We are newer in the Milwaukee footprint. I will later be showing you a map, but we've actually been a Wisconsin-based company for 25 years. We are provider owned. So in your neck of the woods, we're owned by Aurora Healthcare, we're owned by UW and Gunderson Health Systems. So just to give you a little bit of background, that's telling you a little bit about who we are. So if you guys haven't seen the Quartz information, that gives you a little bit more detail. Next slide, please. I'm going to go pretty quickly here because I know that we don't have a whole lot of time, but if we can go to the next slide, I'll tell you guys what we're doing for 2023. We have some really exciting changes from last year in the area. You'll notice kind of a theme with Quartz. Justin, one of your questions before is, what are we doing for those people that are lower income? Like, how are we addressing that? What about the cost share reduction? We've really at Quartz tried to meet the need of the member by changing our plans to offer lower out-of-pocket costs for services that they incur. So what we've changed for 2023, we've added lab and x-ray. So historically, your client is going to pay towards deductible and then co-insurance. Now they're going to have a fixed copay for lab and x-ray. It is a per day copay, not a per lab copay. We've also lowered our copays for primary care and specialty. We've also added a 5th tier for our value tier RX. So historically, Quartz has had 4-tier pharmacy. We now have the less expensive tier 5. We have the option of adding adult vision and hardware, and this also includes allergy testing. So when I get into details, you'll see that there's a little bit difference of how the pricing looks this year. We are also offering 0 deductible plans on and off the exchange. All of our plans are available on and off the marketplace. Other than this year, we do have a new platinum plan that is direct only, and you quote that directly through our website and very, very user friendly. We've also changed our HSA plans to be embedded HSA plans. So historically, Quartz has always had aggregate deductibles when it comes to our HSAs, and we changed them to embedded this year. So just a little bit of background, if that term is unfamiliar to you guys, just means that one person is going to be stopping at that individual deductible instead of going to the family. Next slide, please. Just again, talking about the lab and x-ray, just adding that predictable cost. We know several of the panelists talked about how COVID has added expenses to the health insurance and how rates are increasing, et cetera. We also know that people are more hesitant to go to the doctor when they don't know what that cost is going to be. So adding, again, that predictable lab and x-ray copay this year is going to be key, I think. Next. Again, lower copays for primary care and specialty. Next slide, Justin. And then talking about our value tier RX. So when I go into the plan grids, you guys are going to see that 5th tier is there. Typically, it's going to be maintenance medications, again, adding that extra value for consumers to have a lower cost. Everything we have on our website, or if you guys are using Health Sherpa or Medicare or healthcare.gov, everything links to our website. Our website was created for consumers, navigators, and brokers in mind. It is very, very easy to navigate. So you guys will have hyperlinks to all of these search features. Next slide, please. Again, we're adding adult vision. This is the buy-up option for 2023 on all of our plans that are non-HSA or non-standard plans. We are also offering standard plans for our marketplace plans. So this is obviously giving that additional option as well for this year. Next slide, please. Again, HSA plans are embedded. This is something we've been wanting for many years. It is something that our brokers have been asking for and our consumers have been asking for. So again, giving them a little bit more cost effectiveness there with the embedded deductible. Next slide, please. So for 2023, we use the term good, better, best. That's not what we're going to be seeing on the marketplace, but you're going to see 3 different pricing for the plans. So basically, you're going to be seeing our original plan, which is going to include all the essential health benefits that are required by the Affordable Care Act. Second pricing is going to be including the vision and the allergy benefit. And then we do also offer dental on all of our plans that are not standard in HSA as well. And that is a true dental plan. It includes preventative and basic and major services. Next slide, please. We can go past that one too. All right, so here's a map. This is going to give you a little bit of information about where we're at. So you guys are primarily in the purple footprint. We did not lower any part of our service area for this year. We've included Florence County, so we've added 1 county, but you'll see that there's green counties, there's blue counties. We're also in Northern Illinois, Minnesota. If you sell a plan to a customer, say they're in Milwaukee County, as long as that doctor is within our network, they can go to that doctor. It doesn't matter what county they're in as long as they're participating. So of course we have Aurora, UW, Gunderson. We have Theta Care. There's a whole list of regional providers. We have Pro Health in Waukesha, extensive listing of providers that they can choose from. So even though it's an HMO and they purchase in 1 county, as long as that provider is available to them, they can doctor in all of that service area, as well as urgent and emergent care. And then we also have emergency worldwide. Next slide, please. So getting into plan information, just to give you guys a kind of a high level overview, if you can go to the next slide, Justin. Perfect, thank you. So in this footprint, you're typically going to run into what's called Quartz One. So that is the name of our network. So when you're searching through healthcare.gov or when you're going through Health Sherpa, whatever your avenue to get to the plans are, the name of the network is always going to be in the plan document. So it makes it pretty easy if you're not remembering what it is. It'll say Quartz One Platinum or Quartz One Gold, just featuring the Platinum plan that is our direct only. But again, if you notice the pharmacy copays, very, very favorable pharmacy copays. We also have a huge selection of pharmacies. There's not different network pharmacies, but we have Walgreens, Walmart, CVS, Costco, Hometown. It's extensive. We have over 300,000 pharmacies in the United States, so it's very, very extensive. Other thing to point out in the plan grids, again, I'm not going to go through in detail. I know, Justin, you're going to be providing this to everybody after the training today, but just making sure you guys see that we do also offer virtual visits at no charge, those lower primary care and specialty copays, adding the lab and x-ray copays everywhere we could, other than the standard and HSA plans. It really, really trying to make the benefits cost effective for the consumer. Next slide, please. So you notice we offer the Platinum plan, we offer the Gold plans. We have an extensive list of 5 silver plans, and 6 silver plans and 6 bronze plans. People have said to me, why does Quartz offer so many plans? We really want to meet the member where they're at. Maybe they want a plan with lower pharmacy, maybe they want the lower max out of pocket, whatever that it is, we want to give them options. So again, I'm not going to dive deep into the benefits, but this will be shared with you guys, but just making sure that we reiterate some of those cost savings that people are going to be seeing if they choose Quartz this year. Next slide, please. And then just mention we do also offer a catastrophic plan for people between 19 and 30. Again, 3 primary care visits at no charge, and the rest of the plan is deductible. Next slide, please. So the Find a Doctor tool, again, our website is very, very user-friendly. When you go out to the Find a Doctor tool, the key is going to be changing the location of where the doctor is going to be located that you're searching for. You'll select a network, so you'll select Quartz One in this area. If you happen to be in another part of the state that maybe has our tiered choice product, you would be choosing that network. But again, very, very easy. You can search by hospital, doctor, clinic, all different ways, and again, very user-friendly, and you can hyperlink those or make PDFs to send to your clients as well. Next slide, please. So then the extras that you're going to be getting with the individual plans this year for Quartz. So again, we do offer the option of adult dental. This is available on all of our plans other than HSA or standard. We do partner with a local company in Madison here called Momentum Dental. We've been in the ACA business prior to ACA. We sold individual plans prior to the Affordable Care Act in Wisconsin. But when the Affordable Care Act started, we realized that there's people oftentimes coming from a group plan. We wanted to make sure that they had options that would feel similar to their employer-sponsored plan. So again, this is going to be a buy option. It's something that we've had for 10 years. They will get a separate Momentum Dental card. The key to this benefit is there's absolutely no waiting periods for any benefit, regardless of previous coverage. So say, for example, they needed coverage for November 1st, they will get that benefit without any waiting periods. It's 100% coverage for their preventive services. Then their basic and restorative benefit is limited to $1,000. So it's a pretty traditional 180/50 plan. But again, absolutely no waiting periods. I tell people just price to see what it costs to add the dental, and then knowing they will get a separate dental card from Momentum. They do rent a nationwide network. It is good. So I'll send out some additional information to Justin to share after this, but they have a really user-friendly, again, website that you can find their providers. Is pre-filled with quartz, very good partner, and excellent, excellent customer service. They are provider owned, just like we are. Next slide, please. Just a little bit of information about the benefit for the people, or pediatric benefit, I should say. Again, 100% coverage for preventive services, no limit for basic and restorative, also includes orthodontia. Orthodontia does need to be medically necessary. It can't be cosmetic. So just a FYI there. But so if somebody is looking at one of our plans to purchase the dental, it does have to be on for the whole family or no one on the family. And then it does stay on until renewal unless somebody has an SCP that they need to remove it for. Next slide, please. We also have a team within our customer service called Quartz Champion. Our customer service satisfaction is 96%. We are very, very, very dedicated to our clients. Everything is local in Wisconsin. We do not outsource anything to other parts of the nation or other states. Everything is done here. A Quartz Champion is a subset of our customer service department. It's basically more like a concierge type customer service where they're going to be getting assistance with, finding doctors and referrals and appointments. They don't need referrals within our network. Kind of like Doug had mentioned earlier, we are an HMO, but we are not a gatekeeper HMO. As long as the doctor's in network, we do not require a referral to pay any claims. The specialty clinic might require to see that provider, but we don't require it on the insurance side. So just talking about Quartz Champion is available to the members as well. Next slide. We also have a digital wellness program called Quartz Well. If you can go to the next slide, Justin. So this program is free. It's something that people are automatically enrolled in. I'm not going to go into too much detail about it again, because I know we're short on time. It does give adults on the plan up to $100 a year in a digital Amazon reward card. Very easy to earn points. A physical is $25. If they sync a device like a Fitbit or an Apple Watch to know their physical activity level, we give them $50 a year for that. Very, again, user-friendly. They just need to have a MyChart account and we do everything for them. So usually what I tell my navigators or people that I'm talking with and brokers that I train, I don't expect you guys to be experts on all of this information. What we ask is if you enroll somebody with Quartz, just tell your client or member to look for their welcome packet, because we will give them detailed information on all these extra benefits they get to have. Next slide, please. We also offer virtual first and virtual visits is a theme of the day. We recognized during COVID too that people wanted to be able to have access to care in a different way. So we've enhanced this benefit. We enhanced it last year, but just talking a little bit about it. Zero cost share if they have a telehealth or virtual visit with a primary care, behavioral health, or urgent care provider. So they do need to go through an app either on their tablet or their phone for their virtual visit, and then telehealth is phone. But you'll see by the picture that you would actually be Skyping with a doctor, and then those visits are free. Very user-friendly. Next slide, please. Okay, I ran really fast. There's more information I know that you guys need, but just giving you my contact information here. We also do have a digital packet that includes information about the benefits that I'd be happy to share with Justin afterwards to share with you guys. More information, but again, I know some of you are not familiar with Quartz. We're kind of newer in the area, but please reach out with anything that I can assist with. And thank you again for everything that you do. We value and appreciate what you do for your clients.
Thank you, Angela, and thank you so much to everyone who stayed on it. This group is always great because they're always willing to stay on to hear all the information because there's so much rich information. Again, the purpose of this QHP panel is really to provide a, kind of a holistic and agnostic overview of all the carriers in the Milwaukee County area and beyond, to just give enrollment assisters, CACs, navigators, just an update this year, and then kind of an entry point to all these other resources. So everyone named, just all the additional ways to find information regarding their carriers options. And I just want to name that. I do appreciate the attention to technology and behavioral health and wellness and addressing upstream factors and all the things that were named by our speakers today. I know we don't have time to get into any Q&A, but I do just want to really thank everyone for their time, all 6 of our panelists, and for everyone taking the extra few minutes this afternoon. Hopefully it was helpful and useful information. So you're going to get an email with, we'll call it a mega email. It's going to have our MCAN resources, so the comparison chart, the agent referral guide, our enrollment year report, and then there's going to be a link to a Google folder that's going to have the full slide deck, a recording link, and then individual folders for each of the carriers to really dive in. So you have like a one-stop shop you can utilize. So I just wanted to name how that's coming to you. So look out for that coming to your email. I want to thank everyone again this afternoon, panelists and attendees. It was really wonderful to have everyone engaged. Thanks for being cognizant of time, and have a wonderful day. And we'll hopefully connect some point soon, maybe in person.
Yeah, thank you very much, Justin. Thank you all.
Thanks, everyone.
Yeah.